practicing pharmacy for over 15 years, and I have special interest in immunization and non-communicable diseases. Um, so I've been with in Overx from inception over you know 5 years ago when the project started, and it's something that we're very passionate about. And we're just kind of excited to see where we go as we plan on starting here this year our first venture. I was approached by Dr. Badje sometime in 2014 about the idea of giving back to Africa. It's something that I've been thinking in that line as well. So when he approached me with that, it kind of our ideas and our vision and passion kind of aligned in that. So we bought into the idea, and he laid down his vision how he wanted, and it was an honor for me to to be a part and to join, and since then it's just been an overX. I'm the chief operating officer um, of the venture, and we're going to be opening the first location in the Gambia sometime later this year. So we're excited about that. We're also excited about the services we're going to be bringing to the people, of the Gambia, but particularly the people of Africa in general. And that's where we are now. So some of the services that we're taking back, it's more, from the service line. It's more us trying to give back, but more importantly, it's we have the impetus in us to kind of try and show the world and the people of the Africa that that they can also do more. We're bringing services, innovational services like the one model one. Novel one is the medication therapy management. We'll be managing non-communicable diseases. We're looking at, for example, a disease like diabetes is one of the, the silent and biggest killers of, of people of sub-Saharan Africa. The World Health Organization statistics show that. So to be able to, help people manage diseases like diabetes, high blood pressure, high cholesterol, to reduce all the incidences of complication that is taking the lives of our loved ones every single day. It's a big incentive for us. It's something to look forward to daily, to see how very quality medications. Now, one of the biggest problems they have in the pharmaceutical industries in Africa is the fact that Africa is considered like a dump ground where we get all the medicines that don't meet the quality testing standards. They dump it to Africa. There's a statistic that says almost 1 out of 2 medicines in Africa is fake. So being a U.S. company, we will be able to get medicines that meet the standards that are manufactured from facilities that also meet the standards. So we'll be able to maybe kind of address that problem in the magnitude that we would in terms of reducing the amount of fake medicines in that are circulating in Africa, and also making sure that people are getting the right medicines at the right time. Some of the other services that that we're bringing in is just medical tourism and telemedicines. We all know that there's a gap in infrastructure level in terms of what Africa has already. We're making lots of progress in Africa, but that's coming slowly too. So we have a partnership agreements with a couple of very big super specialty hospitals in India. We'll be able to triage some of the patients that have very huge complicated cases over there for them to receive the care that they need. A lady in Cameroon, she had a necrotic event where she was losing tissue just above her lip here in the mouth, and she'd had that for over 10 years, and the doctors back in Cameroon could not really tell her what was causing that, and they had no way of of treating her or stopping that. And she had contacted us, and we contacted our partners in India, about the issue. They requested her, her medical history, which we coordinated and send that out to them. Eventually, we're able to get the patient to go over to India, and and she had multiple surgeries for that, and it was corrected, and she was on her way back to Africa. Another case we had that was almost critical. We had a lady that had an aneurysm. We had a call that she was, she every time they found her passed out, in a restroom, and the doctors in Cameroon in this case had said that she had a brain hemorrhage, and there was, they weren't sure, there was nothing they could do for her. So pretty much she was just waiting to die, if I could say that. So when they contacted us, we contacted our partners over in in India, and they asked for a medical history and a workup of what was happening with her. She'd been having those episodes for over 3 years. We were able to transmit our medical papers to our partners over there, and they were able to arrange for visas for her to go over, and she went over and she had an operation. Since then, she's been back in Africa, and she's been doing good. It's been, I think, getting to 6 months now, 7 months. She's not had any episodes again. Yeah, we had in this particular case, we had we had a gentleman contact us. I think it was a friend that she had a grandmother that was really feeling down over 6 months, and that she was seeing doctors, and they had her all kinds of medicine, and she wasn't feeling better, and she was taking the medicines. So he wanted us to just go look and talk to her and see what was going on. When we went to visit her, it was very surprising because she had all this, pills in small Ziploc bags. So she had over like 15 pills that she was taking. Come to find out, and she was taking like duplicates or even triplicates of all the medicines. She was taking medicines that she really need to take. She was eventually being hypoglycemic because she ended up taking. She was taking, I think, like 3 or 4 different kinds of sulfonylureas that what is used to treat diabetes. So she was really feeling crappy. So eventually, we were able to do a medication reconciliation, um, which is what it's normally done here in the U.S. We're able to do that, and we were able to reduce the medicines that she was supposed to be taking. I think it went from over 15 to down to about 4 or 5 of them. This within just 3 days or less than a week, she was feeling a lot better. And she even asked for her son to call us, and just so she could tell us that she was feeling so much better, and how grateful she was. Now, if
Any
you think
last
about,
nuggets that you want people to know about InnoverX that will draw them into you guys?
I think it's the concept of Innovarex is overdue for Africa. Um, we try to we try to look at it as a culture that we're trying to build going forward for Africans by Africans. Not to say that we're excluding the rest of the world, but I think it's high time Africans realize their potential, what we can do, as a people. So Innovares to us is very close to it's very close to our hearts, and that's how we want Africans to feel about the company, because we're here to serve people, and we're here to improve just the lives of those people in Africa that are suffering, because we see no reason why somebody in Africa would be suffering from an ailment, and the disparity in their care is so huge from those that are here in the West, when the majority of people providing the care here in the West are Africans. So we're providing an avenue for a lot of healthcare professionals that want to look to Africa, that want to give back, that want to go back and have an impact. So InnoverX provides them that pathway, and so we're very proud of what we're doing. We understand it's a big challenge, but as sons and daughters of Africa, we are ready for the challenge, and we're ready to bring our services to the people, to serve them, to make them feel better, to make them realize that together we can do everything or anything as Africans.